Okay, we're going to go ahead and get started. Want to thank everybody for coming and joining us this morning. So grateful to have the rain yesterday, and then sad not to be able to do this outside today, but glad for the rain, most importantly. So I'm Francine Rod, and I'm Executive Director for First 5 Monterey County, and I'm pleased and honored to recognize our region's child care providers, community organizations, and families today. We know that in order to live in a community where all children reach their unique potential, we have to work together in partnership. And the distribution of diapers and safety supplies that is done in a community partnership over the last couple of years has been an example of that partnership. And so we wanted today to share with you some of the efforts that have made that possible and to recognize the people that have made it work. So First 5 California has provided critical financial support to help child care providers and families with the supplies they need during this pandemic. SupplyBank.org has done incredible work getting access to hard-to-find supplies. And our First 5 funded partners, a number of whom are here in this room as well, or as we refer to them as the Early Childhood Collaboratives, have worked tirelessly over the past several years to ensure that families of young children would have the supplies like diapers when they're out of stock that were difficult to access or challenging to afford. VITA as well, the Virus Integrated Distribution of Aid program, has also facilitated and activated regional coordination to get these products distributed across a network of organizations in Monterey County. Big thank you also to the Mexican American Opportunity Foundation for hosting this event and for your direct involvement in getting these supplies and other supplies provided by the state into the hands of child care educators and families. In addition to our incredible lineup of speakers with us today, I think we were going to have someone, is Alejandra? Yes, thank you. Alejandra Cardenas, who's a congressional aide from the office of Congressman Jimmy Panetta. Want to thank you for your participation. And is Marisa Hernandez here as well? Oh, Vanessa Gonzalez, great, nice to see you. Field representative from the office of State Senator Ana Caballero. Thank you so much for coming. And now I have the privilege of introducing our first speaker, Assemblymember Robert Rivas. He has been such a staunch champion of early childhood development, not only for Monterey County and our families in Monterey County, but also the children throughout California. So we really want to thank you for that. And early in the pandemic, he also organized diaper and safety supply distributions as well, and got donations and helped deliver them throughout the county. So we're honored to have him here with us today. So without ado, please welcome District 30 Assemblymember Robert Rivas.
Well, thank you, Francine, for that introduction. It's so great to be here this morning. And yeah, these are unprecedented times, and this drive here is incredibly important. It's impressive. And I can recall in the first few weeks of the pandemic, we were near Gonzales, Supervisor Lopez, myself, Senator Caballero. We were at a food distribution drive. But that was really just the start. We didn't know what to expect. And here we are nearly that was about 2 years ago now, and so, these are some critical times, but I certainly want to express my gratitude to the First 5 of Monterey County, to the Mexican American Opportunity Foundation, to SupplyBank.org, my friend, Supervisor Mr. Chris Lopez, and for all those who have made this distribution event possible. And it's really this event. This is an example that when we come together, we can take on the toughest of problems. And as Vice Chair of the California Latino Legislative Caucus, I'm proud of the work we have done as a caucus, the work that we continue to do to improve and bolster the lives of all Californians, but with a particular focus on our state's most vulnerable regions, our most vulnerable some communities. Ensuring that they have the support and resources that they need. That's why it's great to be here this morning to highlight this incredible effort by everyone here. And it's during these times of uncertainty, of economic, some turmoil, that protecting our most vulnerable, our communities, our most vulnerable populations, from poverty, from food insecurity, and from homelessness. It requires broad-based collaboration, some collaboration from local governments and some community leaders, from regional nonprofits, state, and some federal representatives and organizations. And the bottom line is, amid this global, this pandemic, a worsening housing and homelessness crisis, and the highest level of functional poverty in the United States, we have work to do here in California. We have work to do here on the Central Coast. And I look forward to working with you all to ensure that we continue to build on this work, to continue to do the work that is necessary to support our most vulnerable. And over the next few weeks, you're going to learn about our ongoing efforts at the state capitol to address our worsening farm worker housing crisis, not only here but across California. You'll hear about our efforts to improve strategically to strategically target early childhood education funding to our most vulnerable some communities, and reforming CalWORKs to best accommodate single parents and our most vulnerable families. And I can tell you that, again, we all know that we have to do more, we must do more, and I look forward to working together to ensure the best possible future for our children. It's unacceptable that poverty in this state, we have the worst rate of poverty, and that children are those impacted most. And so I'm proud to recognize the hard work that has been done throughout this pandemic to support children, families, and child care, some providers, especially here on the Central Coast. Very proactive effort by our local elected officials, by people like Supervisor Chris Lopez, by the county, and like so many others here in the Central Coast and the Salinas Valley. I'm the son of Mexican immigrants, immigrants who came to California. They came here because this was the Golden State, right? There's no state like California. And they came here in search of opportunity and a better life for their children. And it's up to us, to all of us, to keep that door of opportunity open for all. And we must strive to ensure that future generations, that they can have the opportunity and pursue a better life in this great state as we all have. And that's up to us. And so with that, I thank you all for all of this work. Thank you for the opportunity to be here with you all. I have the privilege to introduce Elsa Mendoza Jimenez, first five of a California commissioner and the director of the Monterey County Health Department. Elsa.
Thank you, Assemblymember Rivas. As a First Five California Commissioner, it is my pleasure to highlight this important effort for our community today. Foreseeing the coming shortages of supplies and price gouging, First Five California, First Five Association, and our nonprofit partner, SupplyBank.org, began a statewide needs assessment and other planning work back in February of 2020. This would lead to the First Five Emergency Supplies Program highlighted here today. Our state commission initially invested $7 million over the first 18 months of the pandemic. Recognizing the ongoing crises presented by the Delta and Omicron variants and young children and families additionally impacted by the wildfires, our commission has continued to conduct needs assessments with our association and SupplyBank.org. While this effort continues to support personal protective equipment, or PPE, distribution, it is also important to highlight that in the 4 years before the pandemic, there were 3,071 hospital visits related to diaper need. Again, over 3,000 hospital visits related to diaper need, the majority of which were to the emergency room. As a director of the Monterey County Health Department, I can tell you that emergency room visits for infants are extremely expensive. And again, these types of visits could have been prevented if families had access to diapers. That is why the continuing economic impacts from the pandemic, it is important that these efforts continue to also address diaper needs of our families. On behalf of First Five California and my office, I want to extend our deepest appreciation to all the contributors towards this expanded community effort here in Monterey County. Next, I have the pleasure of introducing our Monterey County District 3 Supervisor, Chris Lopez.
Thank you, Elsa. I'm here today because I'm lucky enough to say that I'm a member of the Board of Supervisors, and I'm also the chair of our local First Five. More importantly, I'm a father to a 2-year-old. And if you go back 2 years, he just turned 2. That was literally the first week we had cases of COVID in Monterey County. I want everybody to just take a moment and reflect back to those first few weeks when there was a lot of fear, a lot of questions, and a lot of things we didn't know about this particular virus. There was a rush on our stores, and our families who were working, never stopping because we were doing what the world needed, which was putting food on the table, got out of work at the end of the day, went to look for diapers, went to look for wipes, and couldn't find them. There was fear and concern around, how am I going to take care of my child? I, as a father who has a college degree with an incredible wife who has a college degree, we put our heads together and we couldn't find diapers for our newborn. It was a time of concern. And I reflect back on that and I look at what's around us now. We're having this press conference 2 years after that moment of crisis, but it's not because these just showed up. It's because we've been here doing the work with our partners from SupplyBank, First Five, the local First Five at the state, local First Five, and local partners like MAOF to make sure that our community was taken care of. And so it's an incredible numbers I'm about to share with you. And I hope you'll take these to heart because these numbers only reflect what's been distributed here within Monterey County over the last couple years. 855,680 diapers and wipes, nearly 1 million units of cleaning solution and disinfectants, 315,750 masks, 145,000 disposable gloves, 12,320 units of hand sanitizers and soaps, and 160 infrared thermometers. Those are real numbers that hit the residents of Monterey County at a time when they needed them the most in the most helpful way. I want to thank our assembly member for making sure that we had the resources we needed here at home. Our staff were working hard behind the scenes when there were no press conferences and glory to make sure that our families had that much less worry on their shoulders. It is truly one of those things that as I reflect back on the work that we did during the pandemic, that touches my heart every single time. So I hope that my gratitude is a small piece and a reflection of the residents of Monterey County saying thank you to everybody from First Five at the state, SupplyBank, to our assembly member, and to all the team and the folks on the ground who are literally opening trunks and putting these supplies into the arms and hands of the people who need them the most. And with that, it is my great honor to introduce one of those people who worked quietly behind the scenes, never seeking glory, Dr. Krista Hani with the Monterey County Health Department, who also represents us as one of the real leads behind the VITA project. And she's going to share a little bit more with you about what that project is and means to the residents of Monterey County.
Thank you, Supervisor Lopez, for that lovely introduction. The purpose of the VITA project is to help Monterey County residents navigate COVID-19 resources through community health workers, or CHWs. Now, CHWs are trained and equipped to deliver information about the importance of COVID-19 testing and vaccinations and assist community members with access to resources. VITA began in January 2021, and it is reaching thousands of people each month through phone calls, information distribution, vaccination and testing supports, personal outreach, and lastly, direct resource supports for people and families needing to isolate and quarantine. And I can say one of the first calls I got as we started at VITA was from a community health worker coordinator needing to help a family to isolate and quarantine, and they wanted for their children diapers and milk and food. And we were there to help. So working with First Five Monterey County, our collaborative provided thousands of community members with PPE, masks, diapers and wipes, and other essential resources, such as books. I think these are books, right? No, but books. Diapers, sorry, but books.
We did it, distribute books. Yes.
And other essential resources brought to us by First Five California. Today, we're excited to announce that 3,000 child care providers and community organizers will receive supplies, which include 443,760 diapers and wipes, 952,000 child and adult face masks, and 110,400 cleaning and disinfectant products. I can tell you from VITA, relationships matter. And it is because of the strong relationships that First Five has in our community, and this collaboration is so successful for that. Their work connecting community-based organizations and community health workers who know the community to needed resources and supports is critical. I would now like to recognize Dr. Seri Martinez, Executive Director of the Centro Binacional para el Desarrollo Indígena Oaxaqueño, also a VITA partner, who will share more about what today's announcement means for the region. Thank you.
Thank you, Dr. Hani. Hi, everyone. My name is Saraid Martinez. I am the Executive Director with Centro Binacional para el Desarrollo Indígena Oaxaqueño, also an indigenous Zapotec from the state of Oaxaca. It is really important to have this type of collaborations, and we're very grateful of First Five California, First Five Monterey County, and the Supply Bank. As we know, farm workers here in the region and in the state don't have a full-time job. It is a seasonal basis, and even their salary is not enough to save, sometimes for rent, or in the pandemic to decide whether they buy food, they pay light, or they pay for childcare, or many parents decided to stay home. So income was really short for our families, and having the necessity to buy diapers for the kids is really an extra burden that sometimes they have to decide whether they buy them or not. We have many calls all the time at our office because of our collaboration with First Five that always are looking for diapers or any other supplies to take care of their children. And we know that it's vital for our kids to have what they need. We're very grateful that we've been working with First Five and also with the VITA project as a partner to really meet the need of our communities here in the county, and especially in South County, as we know that resources are even more limited in that part of the county. So again, we are very happy to be supporting our indigenous farm workers in multiple languages. Before the VITA project, we had our Triqui and Mixteco care providers and coordinators within the First Five in South County, and now we have 7 community health workers that speak Mixteco, Triqui, Zapoteco, and that are able to support our community here in the county. So again, I think efforts like this really support our community to thrive, and we hope that we find a more permanent solution to continue to support the families and be ready for when crises arrive. Again, happy to be here and continue to support our community. And now I have the great pleasure to introduce Maria Ortiz, R&R Manager at the Mexican American Opportunity Foundation.
Thank you, Sarai. Thank you very much. Yes, my name is Maria Ortiz. I am the Program Manager for the Monterey County Child Care Resource and Referrals. I feel very honored to be here representing my organization. I always say that working for MAOF, for me, has felt like working from home, where it's not my home. The mission of the Mexican American Opportunity Foundation is to provide for the socioeconomic betterment of the greater Latino community of California, while preserving the pride, the value, the heritage of the Mexican American culture. And it is through our child development early learning centers and family services that we are able to accomplish this mission. Resource and Referrals, MAOF, works together with family child care providers, centers throughout Monterey County. And we want to make sure that our children are receiving high quality of education. Safe environment is part of high quality. That is why, since the beginning of COVID, MAOF worked diligently to support and provide our early childhood educators. It has been a journey. At the beginning of COVID, there was a lot of uncertainty. We didn't know what direction this was going to take. Everything was out of stock. We were getting multiple phone calls from our family child care home providers. We didn't know either what this was gonna, we didn't know what to do at the beginning. The first thing we thought was maybe, we should distribute some thermometers. I had recently purchased some thermometers that were I don't remember the price, but when crisis hit of the pandemic, they doubled the price. So it's been quite a journey with our family childcare providers. They are true heroes. They stood up when the schools closed. They were the ones, with the school-age children. It was a huge challenge for them because they had to be with the children, assisting them with the virtual classes. We've been there, supporting them, giving them the necessary tools, supplies, equipment, and not only that, but helping them understand the guidelines, the social distancing, the ratios, the face masks. We've done, since the beginning of COVID, we've done 21 distributions of PPE. The first one, like I said, was thermometers. This last one, we were able to provide them with testing kits, but it's never enough. It's never enough. Like I said, our true heroes have been the family childcare home providers. They continue providing services to other essential workers, putting at risk themselves and their families. So today we honor our region's childcare educators and thank them for dedicated efforts. Now, I would like to invite one of our true heroes, family childcare provider, Dianita, which she's gonna talk a little bit, say about how this distribution efforts have helped them and how, they've been supporting the hard work that all family childcare providers have been doing since the beginning of COVID. Let's welcome Dianita.
Thank you, Maria. Good morning, everybody. My name is Yanira Rivera, child care provider here in Salinas. I'm really emotional. Thank you for the invitation, First 5 in MAOF. I purchased my home about, December before the pandemic started. I was confused, scared, not sure, to continue with my business, but then I decided, we have a lot of people, community, families that need our support. Schools were closing, families were calling me. Having my own child asthmatic put me in this situation of saying yes or no, but I had bought in masks, disinfecting supplies at the beginning, and I said, with God's faith and everything is going to be well, the kids are going to be fine, and I decided to open. So here I am working with children's. I know childcare has always been really essential, so then I realized we needed to stay open. The kids, needed our support. Now I have been cleaning, disinfecting. Families I've never had to close down my daycare. The only thing I was really upset was, CDSS and the health department had to close some of my areas down. But now we're starting to see that we're opening again. Everything's, coming back a little bit back to normal with this help of all these distributions that we're getting. We need these supplies to keep our workers and families safe and babies healthy. But they are added, expenses sometimes that families can't afford, especially now that the crisis is increasing. I truly appreciate the support from our MAOF Resource and Referral Office and the First 5 for all these distributions and for prioritizing serving our families. Thank you so much for all the support, and I hope I continue to support all my families and children as well, working from home. And now I have the pleasure to welcoming our First 5 Executive Director, Jackie Wong.
Oh my goodness. Thank you all. Jackie Tu-Hung Wong, incoming Executive Director for First 5 California. Can we give a round of applause to Yanira? Oh my gosh, it's and Maria and all the child care workers. That's truth to power. Right? When we all shut down, our child care workers opened up their homes. They didn't know I'm getting emotional. They didn't know what to expect. Right? They kept our economy going. Our essential workers our healthcare workers had to be in the hospitals at the front lines. Our people here who were in the fields giving us food, our grocery workers, Where were they going to have their children cared for, taken care of? Yanira, the child care workers, they kept our economy going. I want us to remember that when we think about recovery. How do we honor them in this moment? Assemblymember Rivas, in the wealthiest state in the nation, we have the highest level of poverty, especially for children. It does not make sense. The highest number of children, highest percentage of children living in poverty, and they have been disproportionately impacted by this pandemic. As such, the Commission took this to heart and expanded the emergency efforts because there was price gouging happening, right? As it was happening, thermometers were doubling, diapers were doubling, and our families who were struggling, who weren't able to go to work, couldn't find diapers, as we know. We included diapers and wipes in our distribution because we know that they were essential items for child care providers and families negatively and disproportionately impacted by this pandemic. Our goal has always remained the same throughout the ongoing efforts of a community spread, to support health and safety and the comfort of our child care providers, frontline workers, and children living in poverty and those who are under-resourced. Again, disproportionately people of color, communities of color, and living in poverty. Right, we were targeted in our efforts to make sure that this was taken care of for our most vulnerable communities. To date, the partnership has provided more than 119 million items statewide to families across the state. That includes 61.7 million diapers, 13.6 million masks, 11.1 million disposable gloves, 30.5 million units of cleaning and disinfectant products, over 500,000 units of hand sanitizers and soaps, 22,500 infrared and digital thermometers, and that's just the beginning. So thank you. We could not have done this without partners in this room and those at the front line. So I just want us to remember that as we leave here today, who we're doing this for, and I'm just grateful to be here in partnership with you all, serving our communities now and in the future. I have the pleasure and honor of actually introducing the SupplyBank.org Executive Director, who I've known for quite some time now, Benito Delgado-Olson. Thank you so much for your partnership.
Well, thank you, Jackie, for the great introduction, and thank you, everyone. And I'm going to be brief because I think everything that really can be said was said quite well, and really want to reiterate on behalf of SupplyBank.org our deep appreciation for the partnership with First 5 California, also their association, which I should say by extension can be represented by Francine today because I know Monterey is, of course, part of that. It was I think when everyone was freaking out about that cruise ship at the Port of Oakland that we first started getting on conference calls foreseeing shortages of supplies, which is a good segue to say what Supply Bank as a nonprofit organization does. Everyone's heard the phrase that a chain is only as strong as its weakest link. Supply Bank was founded because we saw a gap in the safety net, that when disasters happened, that shelves were bare, and that when prices were gouged, those with the least were always the ones left out. And so we heard a lot of great statistics about what this partnership, because of everyone's hard work and involvement, has yielded. This box has 100 diapers and 200 wipes. I'm sure if you went to a variety of stores, you would see that it costs anywhere from $60 to $70. With the partnerships that we have in place, it's about 16 or 17 for Supply Bank. And so that's really what we bring to the table, is the ability to get materials like this into the hands of the community-based organizations like the Mexican American Opportunity Fund in partnership with their local First 5 Monterey County Commission, and in partnership with key lead actors like First 5 California to try to make sure that those resources are available. And certainly the pandemic created a situation where price gouging and just scarcity for the first time was a tremendous problem. And I think it built a lot of great infrastructure and highlighted that the safety net is already there, and they already have trusted relationships with the communities that they serve. It's just a matter of getting them the resources that they need so they can continue to serve those communities as well as they do. So on behalf of everyone at SupplyBank.org, we're just very grateful and humbled to be here and to be part of this partnership, and just thank you all for your tremendous work today and in the days to come. So thank you all very much.
Tito. I'm going to close it out for today. Just again, wanting to thank everyone for the amazing partnerships that we have in this room. Now with children 0 to 5 still not able to be vaccinated, we know the need continues and it's huge. And also there's a need for testing kits. And with the partnership with the health department and with the partnership with our funded partners and Bright Beginnings, we're distributing 5,000 test kits as well to get those into the hands of child care providers as well. So that's really important, and we thank you all for coming today. If there are also wanted to really thank the folks at MAOF again, First 5 Monterey County staff, in particular Sandra Flites, Dina Lozoya, Maria Ortiz, and the MAOF team for their amazing work. Thank you so much for making this happen. For the next several hours, we're going to have folks come through and pick up supplies. Our community advocates will be coming through and picking up the supplies, and so we're excited for that. And we also want to, hopefully, depending upon their schedules, I know some of them may need to run, but may be able to talk to folks as well who might want to do some interviews afterwards. So thank you so much again for coming today. Really appreciate it and look forward to continued partnerships. Thank you.